The Supreme Court, triggered by the Dobbs v. Jackson women's health case, eliminated federal constitutional protections for abortions. With its absence, there's an extremely noticeable impact on the clinical care women are able to access. STD testing and treatment is critical to a pregnant mother's health and the baby she's carrying.
We do, ultrasounds, we do all the exams that we have to.
But Dr. Charlene Collier, a Ridgeland OBGYN, tells me women who haven't been able to access personal health care, much less prenatal care, could face dire issues.
We can't wait till people are pregnant just to get comprehensive reproductive care. People need to have education, need to have access to condoms, to birth control if they need it, and at least education about what's going on.
According to the Center for Disease Control, sexually transmitted infection rates are rising across America. In Mississippi, they're spiking sharply. Primary and secondary syphilis, or the first and second stages of the disease, rose 170% in Mississippi between 2017 and 2021. Congenital syphilis is also surging. The CDC reports syphilis cases in babies have jumped from 24 per 100,000 live births to 78 per 100,000 in the 4-year period between 2017 and 2021. Over that same time period here in Mississippi, the number skyrocketed from 3 cases per 100,000 live births to 182. Mississippi has more gonorrhea, chlamydia, and syphilis cases than any other state in America.
We've been seeing dramatically rising rates of STDs and inside and outside of pregnancy, but particularly as concerning is syphilis in our city, in our state, as it does cause some severe and lifelong birth defects.
Here's a list of some of those birth defects. They include bone damage to babies, jaundice, nerve problems causing blindness or deafness, and so much more. Some defects can be detected at birth. Others may take months or years to discover. Syphilis in pregnant women can also cause miscarriage, stillbirth, or the baby's death shortly after birth.
And so with this donation, we're able to continue to do that.
Dr. Erica Thompson runs the Jackson-based nonprofit called the Magnolia Medical Foundation. The organization helps moms-to-be and families in all 82 counties.
One of our main focuses is to reduce health disparities, making sure that we have equitable health services and resources for families and individuals.
These sexually transmitted infections we're talking about can easily and effectively be treated. According to the CDC, antiviral medications and treatments can be prescribed, and penicillin can be used to treat syphilis. 30 days or more before delivery will prevent passing the disease on to the baby. Dr. Thompson says she'd like to see Mississippi focus on care for women before they conceive.
Let's start talking about earlier about the planning of pregnancies. Let's talk about access to care earlier so that mothers can have these examinations and know their status. They can know if they have an STD, and that treatment can be provided for free.